Okay, so let's start. Are we done? Okay. Now let's go back and do. So the breathing. 80% of us are not doing this correctly. Why? Because we're breathing with our mouth. Okay. Common sense, right? Eyes is for you to see. Nose is for you to breathe. Mouth is for you to talk and eat and chew. Okay? So can we reverse that? We will be in trouble. The reason that we're in trouble is hyperventilation. What's hyperventilation? Breathing too fast. Okay? Too fast, what happen? Decreasing your oxygen. And also you excreting too much carbon dioxide. Okay? So just it's common sense right now. It's coffee, something is smelling good, right? Can you do this? And smell the coffee?
No.
Why do you have to do this? And smell the coffee?
The sense of the smell.
What are the nerves that is controlling the breathing? Olfactory. Cranial number 2. 2. Okay? Cranial number 2. What's the function of that? There's a special nerve for breathing. What does it do? Inhale. What do we inhale? Oxygen. Exhale, carbon dioxide. There must be a ratio, right? How do we register that? The nerve, the brain registers that. So what happens when we do this? And what does it do? What does it do with the ratio? Out of balance. When they're out of balance, then what happens?
No good.
It's no good. The body will tend to hyperventilate. So what do we have to do? Sleep apnea, snoring, asthma, sympathetic nervous system excited too much. Okay, because when the sympathetic nervous system, you need to balance it with what? Parasympathetic nervous system. Breathing is what? Sympathetic nervous system. How's the breathing help with the pain? When you relax, increase circulation, right? When you get more oxygen to the injured area, blood supply to that area heals. Who's controlling it? Your mind is controlling it. Okay? Can you relax your muscles? How? Use your brain. Sometimes when you hit it, you injured it. What do? Relax it. Tell the brain. That's why a lot of people come in here, not only the back, the knee, the neuropathy. What do we have to do? We have to start retraining the what? The brain. Now, when you have a knee problem, right? When you walk with a limp, why do you walk with a limp in the first place? There might be an injury. What do? Your body trying to compensate around it without the pain. But now after a couple of months, you develop a bad walking habit. If you develop walking habit, what happens? It's just the natural nature. You wear and tear. So what do we have to do? We have to educate the what? The brain. That's when my exercise comes in. So the oxygen. So how do we fix the brain? What's the brain needs? Sugars. We have too much sugars. Oxygen. And what? Stimulations. Stimulation is exercise, movement. The right movement to retrain your mechanism. And I already make a exercise, Dr. Dong's exercise for that, and I train people on that. Just one move with one thought. One move with one thought, it helps to solve a lot of knee, hip, back, and neck. Do you agree on that?
Yeah, show it to me.
I'll show it to you. The one that I showed, do you agree that the exercise is good? Yeah. I'll show it to you.
Is it difficult to do?
Is it difficult to do? Is it easy?
Yes.
Is it beneficial?
Yes.
Yeah. So, introduce the nose breathing. Research indicated nose breathing is correct and optimal way of doing it. The way doing it is what? The nose. Do not exhale with my mouth. 3 weeks ago, I didn't know about that. I said, be natural. The natural is breathe through your mouth. No, now I know because science already showed me. Nose is better. I'm not saying the mouth is not good, but nose is better. Okay? So the body is designed for we explained that already, the nose breathing, and there's numerous health benefits from breathing in the nose. Sleep apnea, snoring, more oxygen to the brain. How about tiredness? Right? Tiredness. Okay, mind clarity. All those things is by breathing. Oxygens. The right oxygen to the brain heals. Stimulation to the brain, stimulations heals. Reducing the inflammation that's causing from our stomach heals. So I'm making a lot of connections for my pain patients and their functional medicines. So you will have that when you come and see me. Okay, what else? The mouth breathing bypass the important stage in the breathing process, which can lead into the health problem. Lungs are the primary sources of energy level, right? True? Lung. What's the function of a lung? Taking oxygen. Beyond that, what else? Exhale. What does the exhale do? Carrying of the carbon. What does it do? Inhale and exhale. Pumping effect. What's that pumping effect do? Lymphatic drainage. But when you do it, what happens? You have a purpose. Remember I said a thought, a purpose. A thought, when we exercise, we have to have with a thought, right? How about when you breathe? Any muscle, when you have a thought into it, you will soften it. If you have a knee back problem, what do? Take deep breath in, hold it, and exhale, and soften up muscles. Okay, now, why does the muscle tighten in the first place? Injury. Fatiguing. Why is fatigue? Because there's an injury. And now, the brain spasms up muscles, then what happens? It's tight. When it's tightened up, it restricts movement. Degenerations. Enough degeneration, pain. Right? So now we unwind it. The breathing would help. Okay? With what? Breathing with a thought. Everything is controlled by the brain. If you have the right thoughts, you will heal. It all begins with a dream and a thought.
Dream and a thought?
Yes.
I always want to win lotto. How come I didn't?
I can answer that question for you. Okay. The mouth breathing bypass the most important stage of the breathing process, leading to mouth. The lung is very important. Okay. About 80% of the Western population breathe incorrectly. That's why they open a lot of sleep apnea places, right? The doctor said, yeah, surely you do have a problem. The problem begins with what? Breathing with your mouth. That's why when you wake up in the morning, mouth dry. I need to teach my kids this. Even my son and my daughter, they breathe with their mouth. I see that. So I will learn more and start teaching my kids so that they can have appropriate oxygens. Okay? Breathing them out elevate the blood sugars. Does it? Why? Sympathetic nervous system. Sympathetic nervous system is what? Increasing your heart rate. When you breathe fast, right? Asthma. Wait. When we have people with asthma, then what happened? They have a hard problem breathing because it's constricted. They have to breathe hard and fast because the constrictions. Constriction is more of what? Sympathetic nervous system. Sympathetic nervous system increase your blood pressure and your heart rate. Okay? So mouth breathing deprive the brain, right? The heart and other organs of what? Oxygens. The brain is the most important, right? Other organs, other part of the body is important. Mouth breathing worsen asthma, allergies, rhinitis, and sleep apnea. What's one? Like stuffy nose. Okay? The nose is stuffy. How do you solve that problem? I'll go over that. Just Close your mouth. Close your mouth. Tape your mouth. I tape my mouth now. I tape my mouth so I can breathe with my nose. And then if you do that for 10 minutes, you notice, oh, my sinus is not blocking anymore. And if it doesn't work, there's other techniques. It's coming up. The mouth breathing reduces sports exercise performance and can cause basal constrictions, which can increase the risk of arrhythmia and a heart problem. When you exercise, when you walk, what do? Tape your mouth. When you try to do it, okay? If it doesn't work, just yank it out. But try. I did that, and it works. Okay? And I feel more relaxed. So concentrate. Let your body concentrate to breathe with your mouth. Okay? The mouth breathing leads into increase in mucus productions and constriction of the vessels and hypertension. When you breathe in, what do we breathe in again? Does the oxygen kill germs? That's why. What do you feel? Oh, you have a lot of mucus. When you stuff your nose. Mucus, right? Bacteria. Right? So how do you fix it? Breathe in. Do you associate that now? I didn't associate that before, but now I do. It kills bacteria. Mouth breathing bypass the nasal mucosa, making regular breathing difficulty and can lead into sleep apnea and heart conditions. Oxygen, right? Oxygen to the brain, sympathetic nervous system. You don't calm down with the parasympathetic nervous system. Can you control your heart rate with breathing? Yes or no? Yes, major. Okay, so you don't dictate your heart rate with one measurement. So when you see the doctors next time, what do? When they do the blood pressure, make sure you breathe with your nose outside his waiting room, and when he's doing the pressure, just open your arteries and breathe and open your arteries and see your blood pressure go down. Okay? And when your blood pressure is low, talk to the doctors. See if you can lower down the medications naturally. Okay? So breathing in the mouth can lead into snoriness, okay, which are 90 million Americans suffer from. Can that be improved? Yeah. I will send you this information so you can start sharing it with other people. Snoring is a precursor to sleep apnea and low oxygen level that can lead into like heart issue and death during sleep, lack of oxygen. Okay? The condition from breathing in the mouth, cold, sinus, nasal strip allergies, sinus headache, bad breath, poor digestive system, eye, okay, and deviation of the septum. What are the benefits from breathing with the nose? It's the intake of oxygen. And exhale with carbon dioxide. Carbon dioxide in our body in the blood is very important. And one of the breathing techniques is called what? Buteyko techniques. Okay, you will have a copy of that. Okay, I will email that to you. That is training how to breathe. Do you notice that when you inhale and hold it 1 second and 2 seconds and exhale slowly, you have more oxygen. You feel more relaxed. Then like that. And that technique. So what I will do is I intend to purchase the techniques, and we're going to have an exercise together and go over the techniques.
Exhale to the nose too.
To the nose. Has to be the nose. It has to be the nose. Okay? Nitric oxide produced in the nose kills bacteria, virus, and other pathogens. Oxygens. Okay? Increase blood circulation. We know that. It's common sense, right? When we breathe, what do we stimulate? Parasympathetic nervous system. Okay? Ensure the health balance of bacteria and the mouth reduction and bad breath. What's bad breath? Mouth breathing. Why do you have bad breath? Because the bad bacteria is in there. Now I associate bad breath with what? digestive system, the bad bacteria. What causes cavities in your teeth?
Chocolate.
Sugars. Is the sugars causing it? The answer is no. What causes it? The bacteria. The bacteria break down the sugar. The bad bacteria, not the good bacteria. The bad bacteria break down the sugars into what? Acid. Acid was cause cavities. The bad bacteria. Okay. So when we breathe with our nose and exhale, so we have some of it to kill the bacteria for us. Okay. That's one of the reasons. The next thing, what do you do? Probiotic. What's the probiotic? Now I make a lot of association. The probiotic, how does it relate it to my greens? What's that? What's the greens for? The green blending. The blending. My 5 greens, I said. Because the greens are prebiotic for the probiotic. What's prebiotic? Prebiotic is the food for the probiotic. Probiotic is the good bacteria. Do our mouth needs the good probiotic? The answer is yes. That keeps cavity away. Okay, oxygen is another way. Keep it away. Keep the bad bacteria away. So we need to build it up. Okay, help to maintain the smell and the taste, right? The smell and the taste. And also, what does it do too? Stimulate the brain. Cranial nerve number 2. Okay. And we reduce snoring, prevent sleepwalking, sleep apnea due to low oxygen absorptions. Okay. And the way that they do is the French method. What's French method? Taping. Warning: do not do it at night. Don't just go in there and start taking it and sleep with it.
What kind of tape you put?
The M3. The M3. I'll show you which one. So just like tape it. Practice it first. Okay. First, start practicing it when you're alert. Try to do it for 30 minutes. Just tape it your mouth and start practicing it. If it doesn't work, just take it out. Okay. But it works. Okay. And then what? Tape your mouth when you walk. Okay. Just tape your mouth when you walk. Okay. I did that. Yesterday, I did tape my mouth and burn 400 calories, and I feel great. I feel great. I was using an elliptical. I taped my mouth, and I thought I was having an issue, but no, I didn't have any issue in terms of oxygen. So I'm concerned about the oxygen. You have to. No, in reality, the nose will take care of it. Test it out. Okay, try it. Everyone is different. You have to try it and see what is best for you. Okay. Benefits continue. Stimulates right and left brain. What's the right? What's the right and the left brain? When patients come and see me, even functional medicines, okay, like for diabetes, thyroid, I always train the brain. When people have pain, neuropathy, what do I have to do? Fix the brain. And then back problem, do I have to train the brain? Train the brain again. The whole body, the whole connections. And I'm going to do the connection, not only the pain, retraining the brain. And Dr. Ken had the book on training the brain. Okay, how to stimulate the brain. What's the right brain do? Yes. And the left brain? Where's everybody? How about midline? When you cross the midline. The next exercise I would teach is figure 8. You see the figure 8? You see the letter 8? How about both arms? You see it? So in speech therapy, and a lot of kids, they have like reading issue. What do? They ask them to cross. By a lot of like figure 8, a lot of cross. When you cross the midline, it helps stimulate the brain. Stimulation of the brain is important. When you stimulate the brain with movement, what do you need? You have to have the oxygen. Oxygen will relax it. Okay. Provide 90% of the respiratory system in the air conditioning. We cover 30% of the heat and moist. Okay, that's important, right? The heat and the moist. Inhale and exhale. Okay, and reduce hypertension. Work with the lung movement. Is double with the is double with nose breathing, the lung. Breathe with the nose. Do not exhale with the mouth. Work the lung movement, okay? Mucosal lining, the nose can tap the virus fighting bacteria too. How to tell if your nose is blocked? Congested. How do you solve that? Tape your mouth and start breathing for 10 minutes first. Okay? If that 10 minutes still blocked, what do? You breathe in and just hold your breath as long as you can and exhale. It's a matter of time it's going to unblock that. Try that. Okay? I'm not going to read everything out here. I'm going to send you so that you can just take a look at it and try it. See if it works. It works for me. Especially in the morning, like when I first start doing it in the morning, I feel, how come my nose is stuffy? Okay? And then I do it immediately. It clears up in less than 5 minutes for me. Okay? And cause jar, how to breathe through the nose. Okay? Lips together. Okay? And tape. The most important thing is to just try to tape. Okay? Start first. Just tape with the mouth. The 3M tape. Like the tape, when you do the blood, and they give it cotton and they use the tape to tape, that's the best tape. Because if you regular tape, it peels your skin. When I first started this, I used like a Scotch tape. Oh, when I peel it out, it hurts. Okay. So do that. So the combination. Now we're going to apply all the 4 things that we have. What are the first one?
Exercise.
Yes. Dr. Dong's exercise. Second one is the earth. Third one? Sun. Breathing. Okay, now we're going to combine everything together. Take off your shoes. Pretend this is not on outside. No, you don't have to do it. I just shoes off. The best thing is connect to the earth is outside. Hold your ears with the purpose. Straight like this, right? When you straight like this, where's the force go down to? In your butt. The buttocks. Right? The force. When you do this, bad posture, where does the force go to? On the back. On the back. How about the neck? Okay? So weight distribution. Where did the force go to? The buttocks. When you do the buttocks, where does it go to? Chair. Where the chair goes to the earth, it dissipates, right? So there's no strain. Okay? So that's what you have to do. How can you do this? With the thoughts. With the thoughts. Exactly. So when you train yourself, you have to have it with the thought. Okay? The thought is important. Okay? With the thoughts. And then when you get up, with the thoughts. Where does the thought go to now? The feet. Okay? With the feet. With the feet. So when you're doing this, going up with the thoughts, you have to have a thought in there. If you don't have a thought, you exercise, it's less beneficial. When you have a thought, you have to have a thought going to your butt because it's weight distribution. Straight, straight, and the force going to the buttocks. Go up, straight, feet, going to the feet. All the force, okay? And going down like this. And breathe with what? Nose. And exhale with? Nose. In with the nose, exhale with the nose. Before I said, oh, be natural. You exhale with your mouth is not good. So now I learned. In and out with the nose when you're breathing. That's the seminars. Of course.
Can you cross your arms to do this? Is there any difference? Which hand goes? Which hand
Yeah.
goes?
Yes. The left arms go to the left ears. Right arms go to the left ears like this. Okay? To me, it doesn't really matter as long as you cross the midline. Remember, the midline is where you cross. Why do you cross